Hello, everyone. Welcome to the Becker's Health IT Digital Health Spotlight. My name is Laura Dierda, and I'm excited today to have Roberta Schwartz, who is the Executive Vice President and Chief Innovation Officer at Houston Methodist. Dr. Schwartz, thank you so much for joining us today on our video series and podcast. I really appreciate it.
It's a pleasure to be here with you.
Absolutely. And, I'm excited for our discussion because I know you've got such innovative things happening at Houston Methodist. I truly feel you're on the forefront of so much of what's happening with digital technology, AI, and really integrating that in a smart way that's beneficial not only for patients, but the team you have there at Houston Methodist as well. So I'll look forward to dig in. But before we do, could you tell us a little bit more about yourself and your background?
So I'm a 33, almost 34-year-old veteran of healthcare administration. I've been in managed care, government, consulting, in-house at more the medical school side, and then hospitals for the last 24 years here at Houston Methodist, and have enjoyed a storied and varied career, looking at various aspects of healthcare. Most of all, I'm an operator. I look at the operations and look at how we can make them better. And it's absolutely lovely that you look and say how far ahead we are. It's amazing that I look at other industries and think, oh my God, we have so much further to go. Like healthcare, for as far as we have come, there's so much more to do to make us from where we are to kind of that the place where other industries have gone to and have really embraced that innovative edge and rebuilt businesses. I'm truly enjoying right now the acquired podcast and listening to the history of how so many businesses have come along. And I am incredibly proud of where we are, but recognize how much further we have to go.
Absolutely. And I think that's such an excellent point because, even though we've got that ways to go, it's exciting to think about the possibilities and potential of what technology can do and how building out healthcare in a smart and meaningful way can really truly have the type of impact that you're looking for within the broader patient care space. So, as you mentioned, a lot of things happening right now. But if you were to dig into one project or initiative from the past year or so, could you tell us a little bit about, something that's been really meaningful for you, what you did, and what were the results?
Yeah, it's kind of been a very exciting year because, as you said, we kind of layered on piece of technology and piece of technology to kind of, whether it was care redesign space or in our infrastructure. And this year, we actually opened up our Cypress Hospital, which we've been talking about for a while, called the Smart Hospital. And what that did was it integrated every piece of technology into one kind of hospital. So whether it's sitting in your bed and talking to the Alexa device, turning up and turning down temperature, whether it's looking ahead of you and having a MyChart bedside with full education, full communication dead in front of you that you could control with your pillow talk speaker, whether it's virtual nurses assigned to each unit that can do the rounding on the unit, that could kind of start to change the care model that we have on the units, kind of pairing virtual and not, whether it was our communication devices that we provided to the bedside that they could talk to one another, and talk to the machines. Kind of every piece came together in our Cypress Hospital. Now we have probably 70% of those pieces, maybe 60% at all of our other campuses. And now we're taking all of that and bringing the rest of it back into the remaining campuses so that we continue to upgrade all of those campuses to look as close to Cypress as we can. Now, they had the advantage of building some things into the walls and choices of different infrastructure pieces than all of the rest of us have. But we're doing the best that we can to make sure that everyone gets that experience. And I will tell you, people love it. Patients love it. From wireless, remoteless check-in, to walking into the facility and having you be known, um, to to everything that people are able to control from the beds or from their seats. It's incredible.
And that's amazing to hear. And, what a huge undertaking to kind of first design and then actually implement and build a hospital that is so interconnected. So, driven by that personalization, and then ease of access for the care teams as well. It seems like truly, truly beneficial. And then, as you mentioned, bringing those elements into the hospitals in facilities that have already been built. What have you learned on that process? I can imagine, there are several hospitals and systems out there that would love to upgrade as much as they can. Maybe they can't open a whole new hospital in that same way, but what kind of upgrades should they be thinking about that can be more easily implemented to improve the experience at the existing facilities?
Yeah, one of the things that we've been talking about for years is that we believe that the future is cameras in every room, and whether or not that's in your operating rooms, whether or not that's in your acute care rooms or your ICU rooms, that these cameras and the ability for kind of a processor to process both artificial intelligence information and virtual information is going to be that key and crux for the future. And you don't need a new facility to do that. I'm watching lots of different people do it with a number of different vendors to really watch that come forward. But gathering that artificial intelligence to information has been really critical. And I'll give the example in our operating rooms. I mean, our operating rooms, we're fitting in an additional 10 to 15% more business in the same amount of time using the information that comes off of ambient cameras in the room. And it's fascinating because what you recognize is with incremental information, with like real information, you can start moving things along much quicker. I always give the examples of airlines did this a while ago. There's no Wizard of Oz behind the scenes that says, oh, your airplane is now ready. They're not texting me individually, right? The housekeeping leaves the plane. They say we're ready for boarding. That all happens seamlessly and automatically. In the same way, when we put in the last stitch, the ambient cameras look at that, understand the last stitch has gone in, alert our PACU that the patient is 10 minutes away because they know the average for this doctor from the time they walk out to the time they get to the PACU. So our PACUs are alerted that they're on their way. And it's not this like, hey, call in, call in, call in, find out when they're coming out because the family wants to know. Everything triggers. When we did this with our humans, we found that 60% of the time we were more than 10 minutes inaccurate. Now with the machines, it's dead on accurate because I mean the video is pulling that. And we're trying to do that same thing in our patient rooms. The vital sign buttons that are on our patients now, we have a don't go into the room between 11 p.m. and 5 a.m. We are trying to get back to what we all know is needed, restfulness. Our patients need rest. They can't be interrupted every 2 hours or 4 hours with vital signs. And if we can get that from a bio button, why wouldn't we? So I think that's one of those beauties. And I was reading a report yesterday of all of these amazing catches that we've made between our virtual nurses and our ICU and our bio button that would have never happened before because you have a second set of eyes on these patients. So lots of things you can do even in an older facility.
Well, that's amazing to hear. And, truly, as you mentioned, just having that ability to be, accurate with the timing. I know going between rooms and then to, the vital signs with the patients is crucial. And will really improve the experience. And so that's really cool to hear about. And, of course, very, very important patient care and outcomes results there. And then in thinking through just, how you're able to build upon this technology? What does the next 12 to 24 months look like? Will you continue to grow and develop? What do you see on the horizon?
Yeah, as I've said, we're bringing back that MyChart bedside experience on our all of our TVs and the rest of our campuses. We before the end of the year, will finish the maturation of our communication experience between kind of all devices and our um, iPhones and tap badges type of thing that we will finish. But I think the rest of the year and into next year will be heavy on the predictive analytics side. We're working with companies that really have helped us mature in ways on predictive analytics that are astounding. Kind of that agentic AI, kind of voice to text type of experience, as well as agentic AI that we're pushing out information. I think we will be maturing. And then we'll finally be tackling three areas that have been a little bit lagging in our institution, which is imaging, pathology, and supply chain. And I think those three will be areas that we are excited to tackle.
That's great to hear, and certainly fascinating on how quickly the technology is growing and developing. I know, in the last year, there was a lot of talk about artificial intelligence and, for, of course, generative AI, and now the idea of agentic coming in and making a difference, especially within the operational sides of healthcare, is truly fascinating and cool to see. From your perspective, when you look at artificial intelligence, I know how quickly and rapidly it can change. And so, how do you work with not only making sure you're updated with the technology, but also on the people side, making sure you have the right skill sets and then the change management down so that your teams are ready for the evolution and transformation that you're looking for?
Yeah, I'd love to watch. I mean, we do have some people who will build an AI here. We have some builders, and that's fantastic. Both in our academic institute and our research areas. We also now have a digital health partnership with Rice that we are working through kind of that building, and I think that's really essential. One of the ways to really promote this and build this in a much stronger way is that partnership with universities who have engineering schools and other types of areas where they're going to be, we add that level of clinical expertise and they add that level of kind of engineering, and that partnership is really a beautiful thing. We also have that partnership with A&M, with a special medical school that's focused on engineering and medicine. So I think that's kind of one, the building area. The second area is our partners. And I will tell you, picking the right partners and doing a good job of putting in the sweat equity to help them build platforms for you has been astounding. And I would say that the partners that we are working with, whether it's HDAI, whether it's Epic, whether it's Pieces, whether it is Appella, whether it's CareAI and now Stryker with Vocera, they're MIT SickBay. Like I look at these partners and I'm constantly amazed by what they are building. I mean, like every time I turn around, I'm like, oh my God, look at that. Look what it can do now. And I am pleased to be able to say that it's our in many cases expertise that is in a development partnership to help them. And that's not an investment partnership, right? It's in our self-interest to help these partners be better, because when they're better, we are better. And so I think between these two arms of being with people on that alpha stage of building and this maturation of what is a great platform, those two strategies have really created magic here. And if you ask me to pick one, I would be like, nope, 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 won't pick one, because they both hold that value. And I think I love watching that. Now, one of the things that I think we haven't done as strongly, and we in the industry, when we put in these innovations, there's rarely a clinical trial. Like that's our hardest part, is that we are operationally looking for results. And to pay for these things, oftentimes you need operational results. So the hardest part is we're going to try in our next rendition to do a better job of being able to do the heavy duty research to be able to tell people on as clean of a way as we can, where we are being successful. We are seeing the operational results, and if we're not seeing the operational results, we'll ask a company to or a partner to depart, and move on. But these days, there's lots of ways you can see those results. So picking that right partnership for you is really critical.
Absolutely. That's such a powerful message because I know there's so many different companies and different opportunities to partner on a variety of different services and levels. So to have that strategy in place and, as you mentioned, be really results driven seems like an important approach in order to get this right. Are there any deal breakers that you see typically with companies?
I think there are two ones. One is over-promising. That's kind of one. The second one is companies not recognizing their Venn diagram. For them, they're was talking with a company this weekend that is in the one of the areas that they're in is chart summarization, which I'm like, you and 1,000 other companies are doing chart summarization at this point. When I that and then sat down with them and said, so explain to me your clear ROI, that's where the companies tend to have this like challenge. They can't figure out, and they're in a space that's a repetitive space to what one of the larger platforms is going to do, whether that larger platform is Epic, whether one of the larger platforms is your communication devices, whether one of that larger platforms is a Workday or an Oracle or whatever you have in, right? They're repetitive to what's being built. And I always say that that's a danger spot for companies. If they can clearly demonstrate that they have a unique ROI that nobody else is going to replicate, that's where they're in that beautiful sweet spot of being of huge value to people.
Absolutely. That's really helpful to know and understand. And, great advice, especially as you're looking at trying to make sure you've got those right partners as we were talking about. Now, before we wrap up, I'm curious, looking into the future, what do you see as being possible over the next 3 to 5 years because of technology that isn't possible today?
Yeah, I'm really excited about predictive analytics. That's kind of the area that I'm most excited about. The second one is that the whole field that's just in its infancy of this agentic AI. One for the workforce opportunities, right? That's the agentic AI that workforce health. Like I can't hire 5 navigators. How do I get the work done of 5 navigators without having 5 navigators, right? That's that work. The second one is the ability to predict which patients I need to concentrate on. So one of the experiments that we've been working on with one of our partners is they've subdivided all of our patients leaving the hospital into quintiles, like this fifth, this fifth. And what they found is that if we get the top quintile in their predictive model in for follow-up appointments, then we capture 80% of the readmissions. Right. So we've been working on this care for all, right? Everyone needs an appointment in 7 days. Everyone needs an appointment in 14 days. And the access problems of getting into our practitioners is really hard, right? So when we look at this predictive analytics space, the ability to say, no, no, concentrate on these patients, that's amazing. Like being able to say, let me tell you what problem you're going to have and how often I need to see you, right? Individualized, we talk about personalized medicine. Predictive analytics provides the ability to give personalized care. And we're seeing this in our in funny ways, right? Predictive analytics on we have a clinic of the future that has gone up, and we're working with programs that can predict which rooms are going to be free and kind of where to move people around. The predictive analytics on the care allows our doctors to concentrate. We have an access crisis right now. And the access crisis going on is try to get into a specialist, right? It's really hard. So we're talking about how to provide care with this, this age wave that's coming through, right? We need to provide care for this growing age wave and this baby boomers that we're going to roll through the system for the next 25 years. There aren't enough GI doctors or neurologists or anybody else. So figuring out who needs what and trying to get them to the right place, that's pretty critical. And I love that field and the ability to do that.
Absolutely. And you're spot on. I think the capacity, the access issues are really pervasive within the healthcare space. And so improving that efficiencies, even just a little bit, can make a big difference in not only the care that you're able to provide, but just the access point for community members. So I appreciate that so much. And certainly it'll be amazing to see how this technology evolves within the healthcare space to really solve some of the big problems that we're having today. Dr. Schwartz, thank you so much for jumping on the line with me. I really appreciate it. And I'm really looking forward to as well you being at our Health IT Digital Health and Revenue Cycle event in October. I always love your sessions. I learned so much, and I'm grateful for our time today. Thank you.
Thank you for having me.